Good evening, everyone. I am Amita, co-founder of Nourish Doc, an outcome-based platform for natural and holistic therapies. In our evening session today, we are going to talk about how acupuncture can help with ulcerative colitis and celiac disease. Presenting this topic, we have Elaina Greenberg, who is a licensed acupuncturist in California. Elaina is nationally board certified in acupuncture and Chinese herbal medicine with a focus on autoimmune diseases and wellness. Welcome, Elaina, to our show.
Welcome. Thank you so much for having me. I'm very excited to be presenting to everyone and having a good conversation.
Great. So this is a Q&A session. People who are watching on FB Live or have shared are on Zoom, you're welcome to ask questions. So as a starting point, we are going to start with Elaina. If you could give us an overview of both the conditions, ulcerative colitis and celiac disease.
Sure. So I first want to start off and kind of explain that there's the Western medical side of it, and then there's the Chinese medicine side of it. And so while having a Western diagnosis can be really helpful in terms of Chinese medicine, it's not required in order to have a effective Chinese diagnosis, because Chinese medicine has its own anatomy, it has its own physiology, and therefore it has its own pathology and treatment plans. And so, but from using the Western medical lens, ulcerative colitis is an autoimmune condition that has an issue of the T cells. So that's a part of the immune system where the T cells have a variety of functions, and the function is to attack an infected cell, to activate other immune cells in the area to address the invader, and also to remember the offending invader. So should it be exposed again, the immune system can launch an effective attack faster, so you're less sick. So that's like in a nutshell how those cells in the immune system work in a healthy body. So what happens in ulcerative colitis or with autoimmune conditions is that those cells, those particular T cells, get turned on by something that isn't outside of us. So they get turned on by something inside of us. And so for ulcerative colitis, those cells will start attacking the mucosal layer of the large intestine. In celiac disease, it's a very specific trigger, which is gluten, which is wheat, barley, and rye. And sometimes for people with celiac, it can be oats. And it attacks the villi of the small intestine. So ulcerative colitis, we've got the large intestine, and celiac disease, it's the small intestine. And the symptoms are different because it's a different part of our body. But what winds up happening is that for ulcerative colitis is that there's a series of immune responses and physiological responses to having that kind of inflammation. And then with celiac disease, the immune system specifically attacks the villi of the small intestine. And so the villi are how we absorb our nutrients. And so oftentimes with ulcerative colitis, it's a very kind of specific set of symptoms that can lead to that diagnosis or that has that kind of presentation with ulcerative colitis. However, with celiac disease, because after a period of time, you're essentially suffering from malnutrition, there's quite a broad range of symptoms that exists for celiac disease that's different from ulcerative colitis. And so for me, whether it's ulcerative colitis or whether it's celiac disease or whether it's other autoimmune conditions like rheumatoid arthritis or Hashimoto's thyroiditis, we're looking at the flare state and the remission or recovery state. And so when working with the patient, we'll really talk about what are the symptoms that's happening right now. And oftentimes people who have been dealing with this for a long time will kind of know their triggers. So like for people with ulcerative colitis, like they'll, have a bout of constipation, and then coupled with stress, and then maybe some poor diet and insomnia. And like those 4 factors suddenly become, that's the perfect storm to lead to a flare. And so we'll work in terms of working with people, like it's really important to identify what phase they're in. Are you in a flare state? Are you in a post-flare recovery state? Or are you in a remission state? Or even are you kind of back to that like precursor, like on the edge state? And so really the symptoms that people are experiencing are keys to what's happening on the inside. So whether they're having diarrhea, that can be with or without blood and mucus, abdominal pain and cramping, rectal pain with bleeding, like weakness and fatigue, urgent bowel movements. There's a sensation that you have to have a bowel movement, but that you don't have a bowel movement, fever, loss of appetite, weight loss, nausea. There's such a broad range of symptoms for an ulcerative colitis flare. And when working with people, it's so important to really suss out what those specific symptoms are to them. And then also looking at the whole picture, like how's their body temperature? Like, okay, so maybe on a thermometer, you're running a fever or you feel feverish, but what's your body sensation? Are you hot? Do you have a steaming sensation coming from your bones? Do you have cold hands and feet? What's your thirst like, appetite, for women, like what's your menstrual cycle like? Like those are all really important information to get a accurate diagnosis and an individual diagnosis to what makes you you, so we can give an effective and individualized treatment. Because to just say, okay, well, these are the points for ulcerative colitis and these are the acupuncture points for celiac disease and this is the herb formula, maybe 50% of the time it'll work, or you're just like, and that's because you're not looking at the individual and not taking that into account. And it's so, I can't stress how important it is to really understand each individual person. However, there are some really broad general forms of treatment, especially if you're in a flare state. So for people with ulcerative colitis, like during a flare, like a low to no fiber diet can be really, really helpful to reduce the pain and cramping. It's definitely not a long-term solution to the problem, but it definitely gives relief when you're in so much pain and really just tied to your toilet. And so that is part of getting over a flare hump. And then there's also herbs and acupuncture that can really help relieve those acute flare symptoms. Personally, I am not a huge fan of pills and like the whole nutraceutical supplements that are in pill and capsule form, because they can be really hard to digest. And so having an herb formula that is more in a tea form or using food as medicine is going to be much more effective. And acupuncture or acupressure, if that's something that you're using at home, because you're able to absorb it. Because if you can't absorb what you're taking, then you just have really expensive waste. So.
Yeah. That I think that makes sense, because what you're recommending is acupuncture, acupressure, along with the food and the herbs, and that's easier for people to digest as opposed to taking some pills, whether it's a nutraceuticals or any other pills, right? That's yeah. No, I think so. So moving on, if you could talk about the flare. You mentioned a little bit about the flare earlier, but you could talk about flare and remission.
Sure. So we talked about the ulcerative colitis flare, and then the celiac flare is different. So the celiac flare is when exposed to gluten, and it can be the most micro amount of gluten. So you can have like a vat of soup that can feed 100 people. And if the tiniest crumb of a saltine gets in that soup, it's contaminated for someone with celiac disease, and they can have repercussions that go on for weeks. And so usually there's a GI flare that goes for about 24 to 48 hours that can again be arranged depending on the person. So it can be nausea, vomiting, diarrhea, severe abdominal pain. And And then it can move on to bloating, like painful bloating. And then it can even move on to like brain fog, like physical weakness, like poor coordination, mood shifts that can last for weeks. Because, your small intestine produces, I think, like 90% of your serotonin and 50% of your dopamine are made in your gut. And when you eliminate its ability to absorb food and to make anything, those first 24 to 48 hours for a celiac flare is almost like a junkie going on withdrawal. It's like suddenly you have all these neurotransmitters and you have all these receptors, but now there's no neurotransmitters and you have a lot of hungry receptors. And so it can be so devastating. And acupuncture can really, really help take that edge and severity off. And the herbs can really help with the nausea and the vomiting. And, it's like, well, how can you, one of the questions is, well, how can you take herbs if you're throwing everything up? And it's about dose. So it's really about taking, the base amount of herbs in like slow, consistent bits, in order to get it in to help with that kind of flare. I talked earlier about those memory T cells, and those are like the real culprits. And that's why it's so important to really look at your diet, whether you do have ulcerative colitis or whether, celiac's a little bit more obvious because it is specifically gluten, but there's a large population, if they're not large, but I think like 30% of the people with celiac disease have refractive celiac disease, that even though they are sticking to a really clean diet and doing all the right things, they're still symptomatic. They still have problems. And so that's where herbs are so effective and can be so very helpful for that kind of healing and to break free from those places. And the T cells, which get activated by gluten in ulcerative colitis, sometimes you don't know what's figuring that out. And so that's where like an elimination diet can be really effective to know what foods to start staying away from and to really start paying attention to those triggers, because it can be a little bit broader than it is for celiac. So in a remission state, there's generally two phases. So one, there's the recovery where the villi is healing or the mucosa is healing in the ulcerative colitis. And then there's the remission state where, you're solidly gluten-free or you're solidly ulcerative colitis, like you're trigger-free for a period of time. And then you can start working within those parameters to really help support the immune system to respond appropriately. So like specific things to really help with gut recovery is L-glutamine. It's a amino acid, and it is really helpful for gut mucosa and for those villi to rebuild that villi. I personally really like aloe and slippery elm and mallow. It's really soothing to the gut. It helps keep things really kind of soft and moving through. And then, Chinese herbs and acupuncture, which are all very specific to the person and their presentation. I don't know, are there any questions about that? How are we?
I think we can, I don't see any questions so far. So we can ask the questions at the end of your presentation.
Okay.
Yeah.
Sure. And so, I guess like the other thing is that, for people, autoimmune disease tends to come in pairs. So oftentimes people who do have an autoimmune condition of one, it's likely that another one might be brewing under the surface, or it's already supported. And so during those times of remission, when you're not dealing with a severe gastrointestinal distress, we can work on eczema, psoriasis, fatigue, joint pain, that overall malaise or like brain fog that can still make people feel like, even though they're not in a flare, that they're not living their optimum life, and to really help shift that around.
So there, maybe you could expand, like if someone is suffering from ulcerative colitis or celiac disease, are there any other, like you said, eczema, psoriasis, are these the offshoots of those two things that are happening, or?
No, I mean, that's a difference between Western medicine and Chinese medicine. So Western medicine, you're going to have your dermatologist for the eczema and psoriasis. You have your gastroenterologist for your GI stuff. Maybe you have a neurologist or a rheumatologist for like the fatigue or like the neuro kind of pain or the joint pain. And it's all these little separate kind of specialties. Chinese medicine really looks at the whole person. And so, maybe for some people, like they had eczema and asthma as a child, and now, they have a different pattern manifesting, but it's all really important to look at, to take into that account. And so, it isn't necessarily like which one came first. Well, part of it is looking at which one's bothering them the most, because that you want people to get relief. And so to address that, and then also to always address the root, because when you're looking at a person, they're a contained system that interacts with the outside world. And so we have to look at what that membranous relationship is like. So, for the goal, like a goal for ulcerative colitis is to be able to eat a broader range of foods and to be able to endure a degree of stress and without it causing a flare, or to maybe, you do go out one night and you do have some wine or stay up a little bit later or are working really hard, but that's not enough to like trigger a flare where in the past it has. And so that's where we can go through Chinese medicine and acupuncture to really help expand people's threshold before a flare happens. So maybe you could talk about your question. Did that help?
Yes, absolutely. Okay. So I think moving on, if we could talk about a success case, how you were able to handle this. That would be very good for our viewers to understand.
Okay, good. I've got a few. So one particular patient that we have right up here, DB, deals with ulcerative colitis and has had periodic flares that has landed him in the hospital at different points in time, and just flat out refused restrictive diet. He was very inconsistent and sort of meh about taking herbs. So it's like, they would get prescribed and sometimes he'd take them, sometimes he wouldn't. And so really, but he was totally committed to getting acupuncture every week. And so that's where it's like, okay, I have to work with a patient with where they're at. And so if he's not willing to change his diet and he's not willing to take his herbs, then I still have other tools to use. And so that would be acupuncture and acupressure. And so, when he would experience a flare, even just from acupuncture alone, we were really able to minimize that pain that he was in and to really increase the recovery as fast as possible. And while I kept trying to encourage him, to do herbs, like I think as he started feeling better, it was something that he would consider doing a little bit more. But once we really were able to like hone in on what the trigger foods were, it was essentially his choice. Like he could have the choice, like, okay, well, I know that dairy and beans and nuts like are really not great for me. And he's, was able to abstain from them for a period of time. So then when he had them again, one, it was a conscious choice to have them, versus just sort of like living on without that kind of mindfulness. And when he did have them, he was able to tolerate them a little bit better, because it wasn't like having milk in your coffee every day. And the dosage of those inflammatory foods were less. And so he was able to, bump up that threshold. So that way he was able to have it once in a while without, paying for it with a flare. And so, ulcerative colitis, you do have, like I said, like there's like more wiggle room in terms of your diet as to like how that can be helpful. But for him, you know, acupuncture was really the key in terms of reducing that pain and reducing the intensity of those flares. Now, another patient, PS, she is a person with celiac disease who had refractive celiac. So this person was like so exquisite about her diet and so conscious of eating the autoimmune diet, like that anti-inflammatory protocol, and really good about taking herbs, and just really tried her best to live, like to be as healthy as possible, and yet still had to take like 2-hour naps every day. Had damage, was having elevated antibody levels, had just, you know, despite like being diagnosed for years, like her blood work never stabilized and she still never felt good. And so for her, working her with herbs, because she was so great about taking them, made a huge difference. Like suddenly, like she was able to not have to take naps every day, to like have the energy to, like, when she would first wake up in the morning, there was a sensation of dread because of all the things that she had to do. And so for her to be able to wake up in the morning and be like, all right, cool, what's on the agenda, and feel like she had the reserves to be able to get through it is a tremendous success. There was also like pretty significant joint pain, even though there's no inflammatory foods like in her diet. And so, you know, to be able to provide acupuncture and teach her acupressure at home to help ameliorate and reduce those intensity really, really expanded the quality of her life. And so, you know, and now, you know, again, I talked about the awareness of like those perfect storm moments of like, if you have a bout of insomnia, it's before your period, and there's a tremendous amount of stress, not necessarily having gluten for someone with celiac disease, but for people who have other conditions, those can be a big flare. Or for someone with celiac disease who has refractive celiac disease, and there's those components, you know, we can work from that and, you know, maybe modify the formula a little bit, or to do different acupuncture points to really help kind of overcome that hump, so that even though it's a really difficult period, it doesn't send you in a downward spiral.
I think it helps to learn about the success cases, because it will resonate with the users. I think it would really help if you could talk about any research on efficacy of acupuncture and herbs that we talked about earlier.
Yeah, well, one of them that I found was it's actually almost a 13-year-old study. I really like meta-analysis studies. Like those are the ones that I tend to look for, because they're compilation studies. They look at a broader, so this study in particular, the meta-analysis on acupuncture and moxibustion for treatment of ulcerative colitis. So this one in particular, it's a 13-year-old study. It looked at 11 different studies, looks at their treatment, their study methods, their research methods, and the conclusion. And so it takes a much broader database and is able to give you a broader statistical and much more statistically significant information based on all those studies. And so this one found that the acupuncture and moxibustion, specifically for ulcerative colitis, was better and more effective than Western medicine and much safer. And so, I mean, I think one thing is that not everybody knows what moxibustion is. And so moxibustion is the use of mugwort, which is an herb that is rolled into a wool, and you use it either directly on or over different acupuncture points. And that's just another way of helping stimulate that acupuncture point or the whole body to respond in a much more healing way.
Yes, I've tried. I've had to do moxibustion for my frozen shoulder, so I know what you were talking about. It was very, very therapeutic, and I could recover from my frozen shoulder. To summarize, what would you give our viewers the food and diet home remedies if they're suffering from either one?
Yeah, so I want I think an important takeaway that I want for people is to be savvy probiotic consumers. It's the nutraceutical companies it's a bit of the Wild West in terms of, you can say that it has, like, you can say that a probiotic product has, 50 billion like lactoacidophilus and bifidobacterium strains, but not all the strains survive the acid of your stomach. And in order for them to be effective, it has to get into your small intestine and then to your large intestine. And so there's certain companies that will have little numbers after their probiotic name. So it'll say like bifidobacterium CD X390 or whatever. And so those probiotics are telling you what specific strain, not just the bifidobacterium strain, but the specific bacteria strain that's in there, and you can research it and see if that one survives the acidity of your stomach. And so that way you don't have $70 bowel movements because you've taken these probiotics, but they all just die in the stomach acid and then they go off. And so that for me is something that's really, really important. One specific thing is that but they're just learning. It's sort of like a new wave of medicine in that, they're learning what specific strains do what in regards to anxiety, in regards to gut health and immune health. Like whether it's one's better for diarrhea, if another one's better for constipation. So, but celiacs specifically tend to be low in bifidobacterium. And so that's one that's really important to look for people with celiac disease. There's another product, it's called GI Revive Powder, and it has high doses of glutamine, aloe, mallow, and that is very soothing to an irritated gut. Collagen is helpful for gut healing. Chinese herbs, again, this is something that's based on an individual and based on what their constitution is. So different herbs and different formulas are going to be effective for different people. And then I just got exposed to these phototherapy patches that are really, really cool. And I give them for patients to use at home over different acupuncture points. And so it's a way for them to kind of carry over in between treatments. And it uses your own body's heat that reflects back that wavelength to help stimulate the cells and to have different responses. And so the glutathione helps with detox. The ion patches can help, they're like antioxidant and relieve stress. The EE is for energy enhancers, and so those help to kind of more tonify and warming the system. It's very similar to like a red laser. And the IW, those are ice waves. And so those are akin to the same resonance as a blue laser. And so those are things that people can use at home and over acupuncture points to help relieve their pain and their symptoms. And if anyone has questions, I can definitely give like specific point recommendations about that. One of the things that tends to get missed for people with celiac disease are oats, because they're like, oh, gluten-free oats, but it's a very similar protein structure. And so that can oftentimes irritate people who have celiac. And so I oftentimes will recommend to them to, if they're still eating oats, to cut out oats if they're still symptomatic. And then the MRT testing, that's mediator release testing. So it's a blood work test that the LCAT test is really common and covered by insurance. And the same inventor of that created the MRT. It's like a more evolved version of it. And so what that does is that it takes your blood. So it's a one moment in time. So, blood work is important, but it's also important to remember that here's a snapshot of what's happening right now. And so what the MRT test will do is it'll test your blood against a variety of foods and supplements. And I mean, it depends on like what kind of package you get with it, and food additives and spices and all that stuff, and looks for byproducts of inflammation. So, it's not just okay, you have a specific, because there's different kinds of allergic reactions. There isn't just like one way, and especially for autoimmune disease, which is different than an allergic reaction. And so like, so for example, like my son who has celiac disease, his blood work shows that he's not allergic to wheat, but you know, he has celiac. So there's no way that that kid can have gluten. So this particular test, the MRT test, you can get, and it looks at the byproducts of inflammation, and it ranks the foods into like red foods, yellow foods, and green foods. And so like the red foods you want to abstain from for 6 months. The yellow foods you want to abstain from for 3 months. And then it kind of gives you a guided elimination diet. So versus just, it's much more individualized. And then you can start bringing these food back, like the food back over a period of time. And usually for people when like they have these food allergy tests and they're allergic to like everything, or they're reactive to everything, once you give your body a break and can reduce that inflammation load and all those triggers for a good amount of time, you can start bringing a lot of those foods back. And what you'll find is that maybe there's really just 3 foods that you need to avoid, not 15. And so that really improves your quality of life, because you're able to go out and eat more foods versus just, you know, having like chicken broth at a restaurant without the noodles. But with celiac, you couldn't have it that way anyways if they made it together.
So these phototherapy patches that you mentioned, can you just buy them off the, you know, in supermarkets? Or
so there's a company there. It's called LifeWave, and they've patented and created these patches, and they're really fascinating. If they're not infused with anything, it's like, you know, a sticker, and it has a piece of fiber in them, and what it's so you're not, it's nothing that's going into your system subdermally or intradermal infusion or anything like that. It is, it's like my understanding is that it has like a kind of like a crystalline technology that when your body heat stimulates it, it sends wavelengths back. Like it's like sending heat in a way, like your own body heat back into your system. And then that stimulates the cells in the body to respond a certain way. So it's like when you're looking at the body as an electromagnetic force field, you know, if you even just look at the way cells breathe, so there's like the electron transport chain. So the way cells breathe, they pass this electron down and it creates this whole cycle. And so that electron is energy. And so the movement of that electron is energy, and it creates a certain resonance. And so when your bodies, or when your cells breathe, or when they, you know, make ATP, or when like the mitochondria starts making more energy, or, you know, when they perform these different acts, there's a different resonance for those acts. And so this company was able to mirror what that resonance was, and be able to create, it's fascinating, like to be able to resonate that back. So like the glutathione patch, for example, like they've done studies where 24 hours after the use of the glutathione patch, there's been an increase of 300% of glutathione in the body, which is huge for detox. So that's, I mean, that's really fascinating. And, you know, they have whole lines of stuff, but the company is called LifeWave. And,
okay.
and
that's very, very helpful and useful for all our viewers. We are open for questions now. Someone would like to ask any questions. There was so I think you answered so many questions that our viewers must have had. It was a very thorough presentation. You know, I learned so much myself, and yes. So I think before we sign off, we will be doing other sessions with Elaina, and we will let everyone know. These will be small educational sessions. If someone wants to consult with her, Elaina is available for consultation at Nourish Doc, and we can send you after the webinar a link where she can be available for your any questions and answers. And then anything else you would like to say before we sign off, Elaina, for our viewers?
Gosh, I just want to thank everyone for their time. I know that it's really, that we all have really busy lives, and I appreciate you coming and listening and making the step towards feeling better. So I'm happy to be a part of it. It's a real privilege for me. So thank you.
Thank you so much.
Thank you to Nourish Doc for making this a possibility. I appreciate it very much.
Absolutely. We are trying to educate our viewers and users the efficacy of natural therapies by really providing the research and the outcomes and the case studies. So hope these programs are very useful. Please let us know your feedback. And thank you so much, Elaina, for being with us today.
My pleasure. Thank you.